All right, thank you guys for your time today. My name is Tyler. I'm with Medline. I handle all of the advanced wound care and skincare products for Medline. I want to just touch base on some of the products that you guys have used now that they've been in your system for a couple months, answer any questions you guys might have. The way that we look at wound care from Medline's perspective is a lot of the primary dressings we have work, a lot of the competition's dressings that they have work. So we really try and look at wound healing from a holistic approach. So not looking at just what's the dressing that you're putting on, but what's the etiology of the wound, what's the patient's nutrition levels, what support surfaces are they on. So it's not just skincare and wound care, but nutrition, mattresses, wheelchair cushions, offloading, everything else that's touching the patient that's associated with it has some sort of impact on wound healing. So we have what's called the DIMES principle. So the DIMES principle is listed up top here. It's an acronym that we have that gives you a good framework or an ideology to understand wound healing from the beginning of the process all the way through the end. So the D stands for debridement, the I for infection, the M for moisture balance, E for edge or environment, and then the S is something that Medline had added to this acronym to just talk about all the supportive products that are associated with wound healing that are not necessarily the primary dressings. So I'll go through this acronym, some of the products that we have in it, answer any questions for you guys, and let you touch and feel some of the products and kind of go from there, okay? All right, so for the D for the debridement, anytime you have a wound, the first thing you need to do is debride the wound or clean up any sort of that bad non-viable tissue, remove any of that necrotic tissue to make sure that that wound is ready to be healed and start that healing process. So there's two products that you guys have in there for debridement. The first one is going to be, bless you, the first one is going to be our honey products. So you guys have probably used TheraHoney gel in the past, right? So the way that the honey works is the high sugar content inside the honey will osmotically pull up lymph fluid from underneath that wound. It'll help break up some of that bad non-viable tissue, making it easier to move at dressing change. The other nice thing about the honey is that there's really no wrong way to use it. So some of the other enzymatic debriders on the market, they really have to be, you have to have a certain amount of thickness, you can't use it with certain other products. You have to change them every day. This product is kind of foolproof. You can use it on open, intact, wet, denuded skin. There's really no wrong way to use it, okay? So you guys use the gel for the most part, so you can either put it directly on the wound or onto a secondary dressing. But again, that high sugar content will promote the body, will promote moisture. In saying that, it does promote moisture, so make sure you're using the appropriate cover dressing to make sure that you're absorbing that moisture as needed. So whether that's a foam dressing or one of the super absorbent products, just understand however much drainage there must be, you must tackle that drainage from the secondary dressing since the honey is not going to absorb any of that fluid, okay? The other debrider that we have on the market is the newest product that we have in our arsenal, and it's called Plurigel, okay? Plurigel was created by a physician out of West Virginia. His philosophy in wound healing is that he would never put something into a wound that he wouldn't put directly into his eye. So this product is very cell-friendly, water-soluble, bio-friendly to the patient and their skin, so there should be no adverse reactions, no pain elements that are associated with it. We use it a lot in burn units, which has those are essentially very, very sensitive wounds, so it does a really good job of helping loosen, trap in, and break up a lot of that non-viable bad necrotic tissue. So again, at dressing change, when you remove that dressing, it's going to look like nothing's done anything because all that slough and eschar is still inside that wound, but it should flush out very easily when you use your wound cleanser or whatever you use to cleanse out that wound. If you look at the picture here, this is what the product is comprised of. So it has what's called micelles, which have very hydrophobic core and a hydrophilic surface to it. So what that does is it continually expands and contracts inside that wound bed. What that does is it creates like a continual rinsing effect on that wound. So that hydrophobic core loves those large molecule proteins. So that absorbs some of those proteins in there, and then that hydrophilic surface allows them to move freely throughout the wound. So as it gets in there, it has an opposite effect as most liquids or gels do. So if you put it into a refrigerator, it actually gets very viscous and very liquid-like. Okay? When you introduce it into a wound bed and that temperature warms up, it becomes much more solid. It solidifies and becomes much more of a denser product. Okay? So as you remove that continual expanding and contracting of it helps loosen, trap in, and break up some of that debris. And then as you take off that dressing, it becomes more viscous. It starts to get a lot easier for it to remove at dressing change. We have a 3-day wear time of this product. I think the ideal amount of time, depending on how much drainage or how much slough or eschar in there, is going to be probably every other day to every third day. But just make sure that you're kind of understanding however much slough is in there. If you have that real hard slough or eschar that's almost like a scab over the top of it, typically that needs to be debrided by a physician in that sharp debridement or mechanical debridement. So this product's ideal for some of that lighter slough or eschar that's sitting in that wound, kind of that gray or yellowish material. Again, every 3 days or every other day, you can go ahead and flush that wound bed out, clean out that wound bed, and then reapply. So again, it does a really good job of prepping that wound bed for it to start healing and removing any sort of that debridement that's in there.
So it doesn't have to be daily? Because I was told it was daily.
So it used to be daily. We have a 3-day wear time on it. Again, I think every other day is probably the sweet spot for it. And the reason I say that is because as it loosens up that debris, it's got to go somewhere. So if you leave it in there for longer periods of time, that debris is not going anywhere. It's just becoming not attached to that wound bed anymore. So if you change it every other day, you can flush it out, get some of that necrotic tissue and that debris out of there, reapply so it can attack the rest of it as opposed to the stuff that's already in there.
And every day probably isn't enough for it to work?
Yeah, you can use, I mean, if there's a lot of stuff in there, it might be daily. I would use your best judgment. Again, I would try and start with it. Again, it's an expensive product. So that vial that it comes in is probably around, probably a little over $100. But if you think about how many dressing changes you can get out of it, you can probably let it last for at least a couple of weeks. So that now that cost is broken up over the cost of a couple of weeks. And then depending on however the cost of your secondary dressing is, it makes it more of a manageable figure. So you can probably get 5 to 6 dressing changes out of it depending on the size of the wound that's in there. So if you're getting 6 dressing changes and you're changing it every other day, you're looking at almost 2 weeks that vial will be going there. So if there's a lot of slough, you might need to change it every day. If there's a little bit less, and maybe not so often. Okay? Does that answer some of the questions on that? Do you guys have any other questions on the debridement aspect of it?
Is it like equivalent to the Santal?
To the wound center?
Santal.
Oh, Santal. Okay, so Santal is a little bit different. So Santal is an enzymatic debrider. I always think about Santal as it does a good job of killing things, but it kills everything. So there's all the stars kind of have to align for that Santal product to work correctly. So you can't use it with wound cleanser. You can't use it with silver. If there's granulation tissue, you have to stop using it because it will kill the granulation tissue. This product, there is not all those variables with it. So it does kind of the same action as Santal does in terms of debriding and cleaning up that wound bed, but it does it in a much more gentle way. It's going to be better for the patient and a lot easier to use. Also, Santal has gone through the pharmacy. So I see Santal, a little vial this big, costs anywhere between $190 to $250, and that's typically going to be a few dressing changes, maybe a week or so. So this product, although the cost is absorbed in-house, it's going to be less expensive, probably about 40 to 50% less expensive than Santal is. You don't have the high copays for the patient to pay, and then also there's not as many variables that are associated with it in order for it to work correctly. So again, Santal you cannot use with wound cleanser or silver. However, you can use wound cleanser and silver in conjunction with Plurigel.
So even if we don't have slaw on the wound bed, we still can have the Plurigel?
You can still use it in those situations as well, yep. Now, the one thing that is similar with Santal is you still want that 2 dimes or nickel thickness throughout. Mm-hmm. Anything more than that is not going to be any more beneficial to that wound bed, okay? So about the same amount of product as you would normally use with Santal. Again, it comes with it in a little jar, so you use the tongue blade. We are going to come out with it in a tube version that might be a little bit easier for applications as well. But in the meantime, you just use a tongue depressor on there and put it on the wound again in about that 2 dimes or nickel thickness.
And treatment length-wise, if we start using the Plurigel, let's say, what is it, 1 month, 2, 3?
Yeah, so it's going to be kind of dependent on how the wound reacts to it. So I would definitely use it for at least 3 weeks. Okay, 3 to 4 weeks or so, and then at that point, if there's still progression and still continue to heal, maybe continue to use it, or if it started to heal up, maybe you can use a different method of treatment that's less expensive than that. But I would say you should at least use it for at least a couple weeks, if not 3 to 4 weeks. Okay. Any questions on the honey or the Plurigel?
No.
Okay. So that talks about the D category in here. Now we shift over to the I category. When we talk about the I category, we're really just talking about the presence of silver inside the wound bed. So if there is any sort of bioburden or bacteria present inside the wound bed, you should use a silver dressing. Most of our products come in either a silver or non-silver version. Also, what we try to do is color code these things. So if you see a silver package, it's going to be a silver version of it. If it's a non-silver package, it's going to be the non-AG version of it. Okay. Again, most of these products are available in silver or non-silver. Just be very cautious when you decide to utilize these silver versions. Anytime you introduce silver into the products, it's going to double the cost by at least twice. At least double the cost of the product, if not more. So just make sure you're using it in certain situations. In the last class, somebody said that somebody was prescribed to silver dressings for over a year. Sometimes your body will develop a little bit of immunity to the silver. So if you continually use it, it's not really doing the same thing. You kind of just are spending more money than you need to in those situations. So just make sure that there is some sort of bacteria. You're positive that there's bacteria or bioburden present in there, and then you can use the silver version of that product. Okay? All right, that moves us on to the M category. This is kind of the largest category that we have here in the acronym. The M category stands for moisture balance. So Wound Healing 101 is basically if you have a dry or scant wound, you need to donate or add moisture to those situations. If you have a draining wound, you need to figure out a way to absorb that moisture and manage that moisture to help that healing process. So you always want a nice, moist, healing environment present inside those wounds. So there's a few different products that we have for that. On the dry or scant side, you're going to have two different options. They're both hydrogels. So you have your regular Skintegrity hydrogel, and then you have your Silvasorb gel, non-silver and silver. They both do the same thing. They both add and donate moisture to those dry or scant wounds, create a nice, moist, healing environment. One just has the antimicrobial ability of silver, and the other one does not. Okay? Any questions on the hydrogels? These are the only products that really go along with honey and with pleural gel that go to that donating the moisture into the wound bed. Everything else I'll show you in this category is the opposite. Kind of does that more, that absorbing of it. So you guys have two different alginate that are on your formulary. First one here is called Maxorb. Okay, Maxorb does a good job of absorbing light to moderate drainage. Does a good job of filling any sort of dead space or cavities inside wounds. So anytime you have some sort of depth in a wound, you don't want to just put a cover dressing over the top of it and have dead space sitting in there. You want to make sure that it's all filled up or packed in there so there's no cavity left remaining. Okay, so this product does a good job again of absorbing light to moderate drainage, filling some of that dead space, and it conforms to that wound bed very nicely. So you very, very rarely ever see a wound bed that's very flat and easy to, without any curvations or, peaks and valleys in it. So as this absorbs, it will conform to those peaks and valleys, always making kind of intimate contact with that wound bed. It's derived of algae, so I'd always recommend using this product. If you got an alginate, using this product first to see if it works to your likings first and foremost, okay?
Question, so can we pack with this thing?
Can you pack with it? Yes, so it does a good job. You can kind of fluff it up a little bit. The one thing I will say is that with this product and any alginate product, it's made of fibers. So there's always going to be some fibers that are going to be left inside that wound bed, okay? So I would always recommend utilizing your Skintegrity wound cleanser when using fiber dressings because the trigger, it has a good PSI that will help pull up some of those fibers and make sure that the pressure is in there, removes any of those fibers that are left inside that wound bed, okay? But yeah, you can kind of use it for packing. I'll show you another item later that might be good if you have a tunneling or undermining wound to pack better so you don't have to worry about all the fibers that are inside this dressing, okay? Before I get too far too, if you guys forget some of these items or if you have new clinicians that come in, understand that all of our packaging, not only in the box, but each individual wrapper has educational packaging on the package. So it just gives you a quick 1, 2, 3 process of how to apply, change frequencies, maybe some frequently asked questions. So if you haven't used a product in a while or if you haven't seen it, just know that there's always at least some good information on the actual package before you apply it, okay? The other alginate that you have on your market or in your formulary is called OptiCell. This product has a little bit different technology than the alginate that I showed you earlier. So as that's made of algae, this is actually made of what's called chitoform technology or chitosan, okay? Which is a derivative of crustaceans or shellfish. So first question I always get, anybody have any guesses?
Allergic to shark?
Allergies, exactly. So if somebody has an allergy, are they able to utilize the product? The answer is yes. And the reason for that is because through the manufacturing process, all those allergens live inside the meats and the proteins. So we have removed all those and we only use the shell. I think you asked if it was sharp or not. So it's not. So because what we do is we grind all those up and turn them into fibers. So there's not actually shell pieces that are kind of left in there. It's just a derivative of those shells. But as I get this one wet, you'll see a couple things. One, it's going to obviously absorb all the fluid. And then two, you'll see it kind of really turns into a gel and puffs up a lot. So you mentioned earlier about packing. Sometimes if you have a wound that's got some depth to it, maybe this is the better product to use because it's going to inflate a little bit or absorb that and kind of expand more so than the first alginate will. And then it kind of turns into that gelling fiber. So it's very comfortable for the patient. It's very easy for that to remove. So it's, even though it gets wet, it should still come off in one piece removal. Again, as a fiber dressing though, there will be some fibers left in it. So just make sure you use the wound cleanser to rinse all that out, okay? The other interesting fact about this product too is that it is the only healthcare dressing that utilizes this technology, and this chitosan technology, but it was used in healthcare before previously in battlefield situations. And the reason for that is because it has hemostatic properties. So if you have a patient that's gone to a wound center, maybe they've been sharply debrided by a physician and they come back and they're bleeding a little bit, that wound is bleeding, this does a good job of helping stop that minimal bleeding as well, okay? And then lastly on this too, we've seen some really good results because this dressing has a positive charge. All wounds have a negative charge to it. So if you go back to third grade science class, two negatives don't go together, but a negative and a positive do. So we've seen this attract a lot of those negative charged wound debris that's inside there and help kind of trap those so it doesn't even necessarily sometimes need the silver version because it helps attack those with its positive charge that's associated with it, okay? Moving on to our foam dressings. You guys use our OptiFoam Gentle SA, which stands for our super absorbent. So this is our newest line of foam dressings. Nice thing about this is you have better wear time. If you have any patients that are getting their dressings through their Part B, Medicare Part B, or their insurance benefits, they typically only get 12 foams per month. So you need to make sure that these are lasting for 30 days or so, okay? So the nice thing about this is that it has the adhesion not only on the outside of the dressing, but on the face of it as well. So you get longer wear time with that. The one thing I will say is that one of the goals that Dorothy and Gordon have is to limit the amount of dressing changes. So they're seeing sometimes dressing changes happen twice a day or even every day, and they'd like to space that out to at least every 3 days or so. The analogy that I always give in terms of that is it's very similar to cooking like a frozen pizza in the oven is wound healing. So every time you put that pizza in the oven, if you continually open up that oven drawer and release all that heat out of there, it's gonna take longer for it to heal because that temperature is not intact. Same thing with wound dressings. So as you peel this off and you remove it, right, the temperature inside that wound bed drops dramatically. It takes about 4 to 6 hours for it to get back to that optimal healing temperature, okay? So what you can do is you can kind of lift up and just peek and then put back if you don't need to replace it, or if it does need to replace, then you go ahead and do your wound cleansing and you change that dressing, okay? Other nice thing about this product too is if it binds up against itself like this, you haven't wasted the product, it easily just peels back and you can reuse it without necessarily having to toss that dressing out. It's still able to be used, okay? And then again, as you peel that up, it's because it's so gentle, there's no sensitivities or pain that's associated with you peeling it up. If you would have looked at the healthcare market or the wound care market specifically 10, 15 years ago, everybody was using hydrocolloids, right? Now they've all shifted to these more gentle products because those hydrocolloids tend to rip the skin off. It's a much more acrylic, aggressive adhesion. This is more gentle, so it's causes less trauma for those wound beds, and less dermal stripping occurs as well.
So these can go for 3 days.
They're actually approved for
3 to 5.
up to 7 days based on drainage though. I would say that 3 to 5 is probably a really good sweet spot for them.
Only for protection, yeah.
Yes,
We don't
exactly.
do a lot every day.
Yeah, if you got a draining wound, it's going to be more
I
often.
call Central Supply and there's a good.
The other thing that I want to notate too, sometimes people will use these for skin tears. If the flap is still on there, you can use it for a skin tear.
Yeah,
What I recommend,
protection.
yeah, for protection, what I recommend is drawing an arrow of which way you want that to be peeled off. So if that skin flap is this way, draw an arrow going that way so they peel it from the top down.
Okay.
So you're not peeling that flap and bringing it with you, okay? So you're kind of going with the grain as opposed to against it,
Yeah.
okay? And then again, yes,
Yeah, so I need to go through all my treatments to make sure they're at least 3 days.
at least 3 days, yes, absolutely.
Or PRN first.
Or PRN, for sure, okay?
Some of them, yeah.
Um,
In fact, they're very nice and we changing them every day.
Like who? Name one that you're thinking of.
Marianne and
Marianne.
Marianne, yeah, Zablowski.
Thank you so much.
You're welcome.
I actually learned a lot.
Great, appreciate it.
I have two
Oh.
I
questions.
changed it this morning. They were nice. Yeah.
The other thing you can
You should
do,
only be getting one back there now. If you see that, I
I
do see
put
one.
one, yeah, but it was when the ones that I was going to see them now. You see.
and we do have those in sacral versions as well. So just make sure if there is a sacral one, sometimes it's the optimal size for them. So we have a 7x7 and 9x9. The other thing too that might help with making sure these things last a little bit longer is you can actually go ahead and write on here the date that you put that on there and maybe your initials. So if somebody comes in, they say, oh, it was just put on earlier today. I don't need to worry about or change it. I'll just leave it in place. Okay? That might help with some of the, a lot of times nurses are very passionate about it. They want to make sure and they check the patient so everything is all systems go. But they don't know.
Thaddeus is twice a day right now.
Yeah, twice a day is not going to be beneficial for them.
Yeah.
Or you come in and it's last week's date,
And
7 weeks ago.
that's also a little bit of an
Yeah, I
issue.
just found out, and I changed it this morning, and the evening nurse comes and changes it every night, so twice a day, the same thing, which is
Who?
ridiculous. Thaddeus,
All Thaddeus?
yeah, both legs.
The other recommendation I have, some people say sometimes they don't necessarily always last as long. Obviously, if they're on there for 7 days, they're lasting. But the other recommendation is that Sure Prep skin
Yeah,
prep that you
that
guys
works.
use. If you guys put that on before, that will look great. And then also with the sacral version, a lot of times the issue is that you'll put a sacral dressing on or something in that area, which is very prone to a lot of bacteria, heat, moisture, sweat, friction, and shear. If you put that on and you take that skin prep and you paint the outside of the dressing after you put it on, so if you put it on and you kind of just paint the edges down, what that'll
work.
do, it'll create a nice seal on there. If there is an
Oh.
incontinent episode, that incontinence is not going to seep into that dressing where you have to rip it off and change it. You can oftentimes just wipe it, top of it clean, and you still have a good seal and you can leave that intact. So that just will help with some of the extended wear time for these dressings as well. Okay? All right, so the alginates, the foams, do a good job of handling some of that light, moderate drainage. We just mentioned trying to keep these things on for as long as possible. So obviously you can only keep this on for as long as the exudate will allow you to. So we have two products here that I'll show you that go into this super absorbent category. First one here is called Quick. Quick stands for quick wicking. So what it does is it takes the fluid, pulls it up and out of there, so it kind of removes it out of there. So if you have a situation where maybe it's a stomach wound and the patient's bedridden, so gravity is not your friend and some of that exudate is just pooling underneath it, this dressing will actually remove that exudate and then get it up out of that system. So the way this demonstration kind of works is if I just pour some water on this carrier sheet here, and I just even introduce a corner of this dressing into it, okay? Takes a little bit of a minute for it to kick in here, and the water's kind of cold. But it will actually fully get all the water that's not even on there. It'll eventually suck it all up and wick it away. So there's 3 layers to the dressing. The blue layer should go up, blue to the sky, white to the wound, okay, because it will wick vertically, right? So the first layer is that wicking action. That second layer is a little bit of a storage layer, so it stores up until its capacity. And then the third layer is actually the indicator layer. So as this blue layer turns colors, you know that that exudate has passed through there and it's kind of reached its capacity. Some people, you can cut this dressing to size. Some people will cut it and they'll stack it on top of each other if there's a little bit of depth to it, so it'll absorb up or wick away once and then wick away again after it's passed through. Some people will cut it into like kind of like the pigtail to turn it into a rope. So if you have an undermining situation where the undermining is has an exudate pooling inside the undermine, you can put it in there to kind of pull up that fluid or that drainage out from the undermining situation so it doesn't just kind of pool underneath there. So this one, if you give it a minute, it'll kind of kick in. I'll talk about the next super absorbent while this one kind of does its thing here. The next one's called OptiLock. So the differences between these two is this one cannot be cut. Same technology in here as what you would see in like a baby diaper or a feminine hygiene product. There's super absorbent polymers inside a dressing that as they absorb fluid, it turns it into a gel. So the benefit to that is if you have any sort of pressure or compression going on it, if I took a rag and I put it in a bucket and I wring it out, all that fluid would come out of it, right? This, no matter how much fluid I put in there and I wring it out, that fluid's gonna stay in there because it's turned into a gel. So I'll put a pretty liberal amount of water on this product. Okay, so for a 3x3 product, that's a pretty good amount of water. It's pretty much already bone dry to the touch. So it has a non-adherent face to it. Okay, it's gonna stay dry, so all of that stuff, no matter how much water I put in there, it's pretty much dry already. And if you feel it, you can kind of feel that gel that's inside there. So if you have bilateral venous stasis ulcers that are just weeping on the legs, we have this all the way up to an 8x12 sheet that you can wrap around the legs, put some sort of compression or wrap over the top of it. It'll absorb all that fluid. You can keep it in place for up to 7 days and not worry about the amount of fluid. A lot of people just use ABD pads in those situations that are kind of get messy. They don't absorb nearly as much fluid, and you're changing them more often. Again, going back to that temperature and heat standpoint, you now have a dressing that's going to hold all that fluid. It's not going to push back onto the wound bed, and you can leave it in place and keep that heat and temperature intact for much longer periods of time. Okay. Now you cannot cut that product because those polymers that are inside there, they'll just fall out essentially. But exactly, yeah. But it's the same technology that you would see in those situations. So, and I'll pass this quick one around now. So all of this water that I poured on there, even though it wasn't touching it, has been soaked up. And then you can see on here the change in color, so you can see what it's indicated. So even though I put one corner of it in there, you can see that it's whipped all the way kind of this way. Okay? Sorry about that.
How long?
So again, up to 7 days, but based on drainage.
This too?
Up to,
Yep.
wow,
It's always going to be based on
You know who
drainage.
needs this is Barb Panka's leg.
yeah, exactly.
So we have that. That's a small size. We got a 3x3,
One, yeah.
4x4, 5.5 by 5.5, 6.5 by 10, and then an 8 by 12. So you can literally take that all the way around the leg, wrap it around, put some sort of ace bandage or compression around the top of it, keep it in place, and you don't worry about that fluid just pushing back on the wound. It all stays inside that dressing. Okay. So those are most of the products in that M category. The next letter is going to be that E, stands for edge or environment. Okay. Basically, what we're talking about here is when you have a stalled or chronic wound. Okay, maybe it's a wound that you've looked at and it's looked the same for the last 3 weeks and nothing's changed on it. The reason for that is there's typically something going on inside the environment of that wound that's now not allowing those edges to close up. Okay, so most of the time it's in chronic wound situations, it's what's called high levels of MMPs. We all have MMPs in our body. They help regulate collagen, they help prevent scarring and keloiding. However, when you get into a chronic wound situation, those levels of MMPs get so high that they continually eat up our own collagen, so our body can never heal. Okay, so this product is called PureCol Plus. It's 100% native bovine collagen. Okay, so it acts as a sacrificial substrate. So you introduce this into the wound bed. The MMPs assume it's our own body's collagen. If you looked under a microscope, there's only about a 5% variance between this collagen and our collagen. Okay, so they assume it's our body's collagen. So the MMPs now attack this, they eat this and break this down, becoming a distraction, so a sacrificial substrate for our own collagen to start redeveloping and regenerating and start healing. Okay, the other mechanism of action here is that it acts as a scaffolding system. So as you put it in the wound bed, that scaffolding will line up, so all the fibroblasts that are coming to help heal the area have a place to organize and to live essentially. So when you put this into the wound bed, there's going to be two things that happen when you take off that cover dressing. I'd take a look at it maybe after every 3 or 4 days, okay? But there's going to be two things that happen. One, you take off that cover dressing and this is gone, completely eaten up. That's a good thing. That means it's been eaten up by the body, it's done its thing, okay? The other thing you'll see is if you remove that dressing, it starts to kind of turn into a little bit of a gel almost, and it's kind of attached to that wound bed. That's good. That means it's integrating into that wound bed and it's creating that scaffolding for that collagen to start living in those fibroblasts to organize themselves on, okay?
So you don't need to remove
I
it.
wouldn't remove it. So at that
Is
point,
that like the Prisma?
it's like Prisma. So the difference between this and Prisma is 55% collagen, 45% fillers and ORC. This is 100% native bovine collagen. So it is 100% bioabsorbable. So if you have those
It's 100%
tunneling,
expensive.
it's more expensive, but if you have a chronic wound that hasn't done anything and you've tried a bunch of different other products and it hasn't worked, you might as well do something that's going to try and heal up that wound, okay? And it's actually less expensive than Prisma and Promorand is too, from a comparable standpoint. So collagens in general are more expensive than other products, but this is one of the least expensive products because we have a little bit more manufacturing pull than some of the other companies out there. So if you have tunneling or undermining situations, we talked about those fibers and some of the alginates and having to flush them out, remove them. You can pack this in a tunneling wound, and you don't need to worry about did I get all of it out of there because it's all going to naturally get eaten up by the body. Okay. So again,
Big size, yeah.
so yeah, we have this in a 2x2, we have this in 4x4, and we also have it in a rope.
Oh.
Okay, so good for packing. Again, when you remove it, what I would do is just kind of clean up the wound, rinse the wound out a little bit, and then either reapply more, or if there's still some intact and you don't need it, just go ahead and put another cover dressing on top of it. Okay? But that's why it's also in that E category, which is basically the last category, because you've kind of tried some of the other methods and now nothing else has worked, so you need to go to maybe a more robust product. So again, if you start to see those edges close up and start to progression that wound to migrate, it's kind of done its job, and you don't necessarily need to continue it. You can kind of go back to a less expensive mode treatment. Okay, so it should be one of your last lines of defense, and then as soon as it's really kind of done its job, go back to something else. Okay. So that kind of goes through the acronym. Again, the S just stands for supportive products. So everything that's not your primary dressing. So your gauzes, your tapes, your wound rulers, your compression wraps.
That SurePrep, does it come in something that's not, doesn't burn?
Yeah, so we had the conversation in the first one. So that's our SurePrep. We also have SurePrep No Sting, okay, which doesn't have the alcohol component, which is what does that stinging. I'm going to have conversations with somebody at corporate to see if we can maybe swap that out. It is better to have the No Sting version. And then we also have our latest version, which is called SurePrep No Sting Rapid Dry. So if you ever use the
Oh, yeah, 'cause you're like,
you're just waiting for it, and you're waiting, and yeah, you're technically not supposed to do that or blow on it.
somebody over on their side.
Right. The rapid dry dries in about 15 seconds, so it saves a lot of nursing time and some headaches for you guys as well. So I'll talk to the corporate office to try and see if we can switch that product on the guidelines, because I think it is beneficial from the no stinging perspective and then also from the nurse clinician saving time perspective as well. Okay.
Definitely no stinging, because sometimes you think it's the skin's intact, but then you rub the SurePrep on it and it's hurting.
It's hurting them, absolutely. So yeah, that's why we have the no sting version available too. So it's not the quickest process, but let me start the process and trying to get that product switched out for you guys. But it is available. And then again, the S is just gonna be all your supportive stuff. So that's including your nutrition, your protein. So we have a product called Active Protein that will help to give protein to residents. Your Skin Integrity Wound Cleanser would help clean up the wounds. Again, your tapes, some of your basic cover dressings, like just your basic border gauze, which is just going to be a very any of those superficial wounds to help cover it up. And then also you have a product called Marathon. If you guys have seen this product before. So you have your SurePrep Skin Prep, right? I sometimes call this our Skin Prep on steroids. So the difference between this and your SurePrep is that if you looked under a microscope when you put the SurePrep on, you'd see your skin, you'd see a little gap, and then that SurePrep sitting on top of it, okay? So as they wash, as there's any sort of wound cleansing, that eventually will wash off. This will actually thermally bond to your skin, okay? So it does not come off your skin until your skin turns over. So all of our skin turns over every 3 to 4 days, so you get at least a 3 to 4 day wear time on this. Some of the big uses for this, if you deal with ostomy patients, you get that peristoma area that's very macerated. It's in an area that has a lot of bacteria, and it's very hard to heal. This, if you can paint this on the outside of it, it'll give a nice pouchable surface where you can put that barrier or flange on top of it, okay? And you can keep that barrier and flange in place for up to 7 days and just change out the bags. So this little vial is expensive. It's probably around $6, but we've seen it sometimes save up to $30 a week in ostomy supplies based on how much you're going through. So the way that this product works, there's a glass ampule inside here that you have to crack. As it hits the oxygen, there's a chemical reaction that occurs. So you'll crack it, okay? You'll see the tip of it turn purple, okay? And then you can go ahead and paste it on. So I put it on a little bit earlier so you can see that purple that's already on there. So you don't want to do it too thick. Some people like to put this on very, very thick. You only need a thin purple layer that's on there. If you do it too thick, it'll bond to itself and sometimes flake off a little bit sooner. Okay, so a nice purple layer, takes about 45 seconds to dry. This little vial will do about a 4x4 area, maybe the size of my palm. So I always tell clinicians, before you put it on a macerated peristoma or a highly draining peri-wound area, think about where else you can use it on the patient. So sometimes they get irritation from the nasal cannulas on their ears or under their nose, and sometimes you use those little cushions that kind of fall off and they never really work. This will create an area that's not going to fall off. That friction is going to occur on the Marathon while that skin still heals underneath it. So it's pretty much dry to the touch now. There's a little tackiness. Once you feel that tackiness, that's a great time to put on that barrier flange because it'll really stick nicely to it, okay? And then it doesn't hurt the skin, or the skin still heals underneath it, so there's no adverse reactions with it. Some people will put it on heels or elbows if they're prone to skin tears or if they got that real sensitive skin. We talked about skin tears earlier. If you have that flap still on there, in the old days, people used to cut that flap off, okay? That's very bad. So they've done studies and there's been research that showed there's really no better cover dressing for your skin than your own skin. So if you can keep that flap down there and you keep that skin on there, you can go ahead and paint this over the top of the flap, and you don't even need a secondary dressing. No steri strips or anything like that. You just can put it in there, leave it in place, and you know it's going to heal a lot better that way. Okay. Other areas too, skin folds under a breast or pannus area. Some people see that red and irritation, and they immediately assume that they need an antifungal, or they put a barrier cream on there. The creams are okay, but they rub against themselves and eventually get skin on skin again. Where this, you can paint this on there, and you're going to have marathon on marathon rubbing, and that's still going to heal underneath. Make sure you put the flap, let it dry before you put the flap down, or it could be a rather sticky situation. So there's a lot of different areas that this product can work. But again, it's expensive, so make sure you're using it in the right situations. But when you do, it can actually save money and help promote that healing a little bit quicker. Okay. Any questions on any of the products I talked about today?
3-4 days?
So so people ask us the question, hey, it's purple, can you make it clear, right? And the reason we don't is so you can see, okay? So you'll see it's on there. In a couple days, 3 days, you'll see that maybe there's gonna be little spots of purple on there, and that's when it's starting to flake off, okay? So at that point, you can go ahead and reapply. But you don't need to worry about scratching or getting it off if you do that. Just allow it to naturally fall off. Your skin's gonna turn over and it's gonna come off either way, okay? So can I get that book real quick?
Yeah.
So the other areas education that we have for you. So obviously we threw a lot at you guys today, but these are some of the products that you'll mostly see and that should be used on a regular basis. We also have other resources for you, as in this pocket guide. So we'll send more of these pocket guides in. It has this DIMES principle in there that I mentioned. So everything from treatment. So you kind of have some of the different types of wounds that are in there, and then you do have, wherever it is here, kind of some of the types of guidelines that you have, some different skin conditions, and then it also talks about that DIMES principle and how that should be utilized in wound healing. Okay. We also are going to send in some more of these black catalogs. Okay. So you guys have a list of all the stuff and more information on sizes of products and which products we have that are on your formulary. On the back of this catalog, there's a phone number on here. It's 1-888-701-SKIN. Okay. Which is 7546. So 1-888-701-SKIN. We have a CWOCN on staff Monday through Friday, 8 to 5. Just to field questions. This is our wound care hotline. They just field questions about wounds. So maybe a wound looked like something one week and now you looked at it next week and you're not sure what's going on. You can give them a call. They've heard it all. So they'll help you kind of talk you through it, figure out what's going on with the wound, recommend some sort of treatment option for you. Okay? And they talk in pretty generic terms. So it'd be a foam or an alginate, not necessarily a Medline product. So it's another free resource that we have for you guys. And then we're also going to be working on uploading you guys on Medline University, which is an online resource. Has CE credits available on there for you, and then a lot of classes and shorter seminars, not necessarily just on wound care or skin care, but on everything associated with healthcare. So from bathing to incontinence to everything that you guys deal with on a day-to-day basis. So I'm going to work with Dorothy on getting everybody's a list of everybody in a roster to get uploaded into the system, and then you'll get an email telling you to change your password, and then you can utilize that as well. And then we can set up Dorothy as like a super user, so she can actually assign courses and classes to you guys, and then check your progress and how you've done on those. Okay? Any questions for me on either the products or anything else in terms of wound care?
Just one question.
Sure.
Yeah, Medline. Do you guys have any wound app, like a wound app?
An app?
Yeah.
I know that
I used
there's.
to work at a facility. We have this app. We take a picture of the wound. It's uploaded in the system, and I don't know if it's
No, so it's kind of hard because you guys would have to. It's almost like what your internal records would be, or EMRs, if that's what you're trying to upload those pictures to it. The one thing we do have is what's called the Any1 Tool Assessment Tool, which basically is like a wound ruler that has different types of pictures of wounds on there. So as you take a picture of it, you can kind of see not only the dimensions and the size of the wound, but then what picture that wound might relate to, okay? So that's also something that we can maybe try and get some samples of you guys too. I'm not sure if it's on formula or not, but we can talk to the corporate office about seeing if they want to integrate that into your practices. But there is also a Medline University app that you can get some educational resources on too. I don't know if you can take, I don't think you can take pictures on it though or whatever and upload those, but that's pretty much the only app that we have. And then also, if you have questions about these products, again, I mentioned there's the educational packaging, but all these products also have application videos on Medline.com. So whether it's our compression wraps or any of the advanced wound care dressings, you can go on there. There's a quick 60-second, 90-second video of just it gives you another explanation of how to apply, what to look for, those types of things too. So if you haven't used the product in a while or you haven't used it at all, feel free to click on that video and get a quick refresher of how it should be used and what to look for. Okay?
Yep.
Any other questions for me? All right, I appreciate your time.
Thank you.
Thank you very much.
Thank you.